What is labor? Demonstrating progressive cervical changes in the presence of regular, frequent, painful uterine contraction. Stages of labor. There are 4 stages. First one is stage of cervical dilation. Begins with onset of regular contraction and ends with complete dilation, latent 0 to 3 centimeter, active 4 to 7 centimeter, transitional 8 to 10 centimeter. Stage of expulsion begins with complete cervical dilation and ends with delivery of fetus. Second stage. Third stage, placental stage, begins immediately after fetus is born and ends when the placenta is delivered. Fourth stage, maternal homeostatic stabilization stage, begins after delivery of the placenta and continues for 1 to 4 hours after delivery. Phases of labor during first stage: latency 0 to 3 centimeter, prodromal early, preliminary 4 to 24 hours, active 4 to 7 centimeter and 3 to 5 hours, transition 8 to 10 centimeter, half to 2 hours. So there will be 3 phases in first stage: latency, active, transition. So latency 0 to 3 centimeter, prodromal early, preliminary 4 to 24 hours, and active 4 to 7 centimeter, 3 to 5 hours, transition 8 to 10 centimeter, half to 2 hours. Physiologic forces of labor: frequency of contraction, effectiveness of pushing. Clue to contraction: frequency, how often; duration, how long; intensity, how strong. Okay, so we can remember DIF. Can you figure out the DIF? So DIF is duration, I intensity, F frequency. Uterine contraction, palpation, timing, frequency, duration, strength. Uterus between contraction, uterus during contraction. Birth passage: size of maternal pelvis, type of maternal pelvis, ability of cervix to dilate, ability of vaginal canal to distend. Anatomy: pelvis and pelvic ligaments. Oh, I can't understand. Dilation and effacement. Mucus plugs. Fetal tube, fetal lie. Engagement station, fetal position. 4 station and delivery. Nurse, why didn't you tell me she was so close to delivery? Oh, I told you 15 minutes ago she was at +3. +4 is the flow. Psychological consideration. Mental and physical preparation for childbirth, sociocultural values, previous experience, support, emotional status. Admission to labor suit, history, contraction when they last, late, vital signs, ultrasound examination. Membranes rupture 600 to 800 cc. Color, odor, consistency, nitrazine paper. Leopold's maneuvers. External fetal monitoring. Tubals, uterine contraction, fetal heart monitoring, benefits, negatives. Internal fetal monitoring, fetal scalp, electrode and internal fetal heart monitor, intrauterine pressure catheter, IUPC and internal contraction monitor. Fetal heart variability. Early decelerations, head compression. Late decelerations, uteroplacental insufficiency. Variable deceleration, cord compression. Maternal responses to labor. Cardio PP, respiratory, renal, GI, immuno, blood, pain causes. Cardinal movement, descent, flexion, internal rotation, extension, restitution, external rotation, expulsion. Fetus moving through the pelvis. Placental delivery, contraction, globular uterus, cord lengthens, rush of vaginal fluid. Causes of pain in labor, stage 1, stretching of the cervix during dilation and effacement, uterine anoxia, stretching of the uterine ligaments. Stage 2, causes of pain in labor, stage 2, distension of the vagina and perineum, compression of the nerve ganglia in cervix and lower uterus, pressure on urethra, bladder, rectum during fetal descent, traction on the stretching of the perineum. Factors affecting mother's response to pain in labor, preparation, knowledge and confidence gained through childbirth classes, cultural influences on expression of pain, maternal fatigue, anxiety, sleep deprivation, previous experiences with pain. Methods of pain relief. Non-pharmacological childbirth methods, breathing techniques, relaxation techniques, touch, focusing attention on one object. Breathing methods. Basic principle, comfortable position, chest breathing, focal point, verbal and non-verbal cues, cleansing breath, rhythmic chest, shallow chest, blunt blow, exhalation, pushing. Non-pharmacological, sensory stimulation, listening to music, subdued lighting, imagery, applying heat and cold, massage lower back, counter pressure, tense, position changes. Pain management, narcotic, analgesics, timing, effects on labor, common meds used, Stadil, Newbane. Oh my god. मेरा pronunciation बिगाड़ दी. Pain relief in liver. Criteria for administering an analgesic needs to be in active phase of liver. If given latent phase, it may slow liver. If given transition phase, can lead in neonatal respiratory depression. Regional anesthesia, epidural, spinal, pudendal side effects, hypotension, spinal cord, spinal fluid, epidural space, epidural catheter. Nursing care related to an epidural. Preparation following. Okay, preparation. Assess platelet count must be normal. Empty bladder. Assess vital signs for baseline IV fluids. Following assess versus especially the BP, because the main side effect is hypotension. Rotate position between right and left side lying. Assess bladder and catheterize as needed. Assess for other side effects and intervene.